Hey everyone, it's Dr. Jen on What's Up Wednesday. Thanks so much for coming in and joining me here in my office on the Upper East Side of Manhattan. And I'm excited to speak with you all today. Thank you for your questions and comments. Today on What's Up Wednesday, I'm going to be discussing choosing the right pediatrician, how to find the perfect pediatrician for you and your baby, or for even your whole family. Because it's actually really important. Because your pediatrician can do so much to help you nurture your baby, to help in growth and development. Sometimes people think, oh, your pediatrician, you just go there to get shots, and then you can just go to an urgent care clinic. But I can tell you, your pediatrician and having like what I call a medical home, a place where the doctor, the pediatrician knows you, your family, and knows the baby very well, is very helpful to following their growth, their development, even if they have acute or especially chronic diseases. Knowing what's been done in the past, what has worked and what hasn't, having that record of immunizations and maybe even allergies, everything in one place can be so much better care for you and your baby. So I'm definitely going to talk today about how to go best find a pediatrician that works for you and your baby as well, because as I say, it's sort of this partnership, and I think it's really important to find the correct one. And the right pediatrician for you may not actually be the right pediatrician that's the same for, say, your friend or your sister or anyone else. So it's important. We'll go through steps on how to find the correct pediatrician that really jives with your personality as well too, and so you feel like you can get as much information as you need to help your baby grow and thrive as well too. So thanks everyone for joining me. Anyone new, let me just give you a little bit of information about me. I'm Dr. Jen Trachtenberg. I'm an assistant clinical professor of pediatrics at the Icahn School of Medicine here at Mount Sinai in Manhattan, and I have been in private practice for over 20 years now, taking care of children from newborn through young adults. So it's great that I get to watch them grow, and it's from newborn all the way up to through college, and it's really exciting. I actually saw a patient yesterday who the dad was a patient here, and now they have a young child too, so it's sort of exciting really to come full circle and continue on with families and have that close bond and relationship with their families and continuing to work as their pediatrician. So that's really exciting to me. I'm also the author of 2 books, Good Kids, Bad Habits, and The Smart Parent's Guide to Getting Your Kids Through Checkups, Illnesses, and Accidents. And of note, recently I have a video series called Pediatrician in Your Pocket. It's the first video parenting guide. So instead of having everything in a book, you now have everything on the go when you need the answers about caring for your baby from newborn through age 2. Everything from sleeping, eating, peeing, pooping, parenting issues, temper tantrums. I talk about nutrition, how to get them to sleep. So many topics that parents have questions on, and sometimes don't even know that they have questions on till they start looking through the video parenting guide. And again, just in this day and age, it's so nice to be able to have something right on your phone to access if you have a question that has come up regarding your child. So that's called Pediatrician in Your Pocket, and for more information about that, you can go to my website, drjen.com. So thanks everyone today. I'm so glad that you are here. As I said, I'm going to talk about how to find the perfect pediatrician for you and your baby. And so one of the reasons why it is so important is because, as I said, your pediatrician does way more than just give those immunizations or those shots. And yes, those are super important because being that I have now been in practice for over 20 years, diseases like rotavirus, a severe stomach illness that can cause dehydration in young kids, pneumococcal pneumonia or meningitis, hardly even see that anymore again because of the vaccines. Obviously we know that there's a terrible flu season now too. Giving the flu vaccine, we know, can decrease deaths in children. Unfortunately, there's been over 30 deaths in children so far this flu season, and over 85% of those children have not been vaccinated. So it's really important. Yes, that's really important, but it's not the only thing that as a pediatrician we do. We also, what else do? We monitor their growth and their development of the children, and monthly talk about what's going on, what to expect, making sure that they're meeting all their milestones and parameters in growth and emotionally, and as well as physically as well too. So it's really, really important. Obviously take care of any acute illnesses that occur, and that's really important. If they have an ear infection or a stomach bug, something that we need to take care of right away, because they can get obviously more sick. But there's also the chronic diseases, and having one pediatrician that can really care for you, that has your child's records if they have asthma or diabetes or heart disease, or even just helping you as a parent to prevent those issues as well too, is really important. So you have to have someone that you can trust, that you really feel comfortable speaking with. In addition, sort of the pediatrician manages the ship, if you will, that if your child has specialists that they need to see, your pediatrician can refer you to those specialists. They probably have an arsenal of ones that they love, and for different reasons, they may use a specific cardiologist or a specific gastroenterologist, depending on the specific need of your child. So it's great to get those referrals from your pediatrician. They'll speak directly with those doctors as well and continue to formulate the plan and be part of the overall team taking care of your child. And also, you know, your pediatrician is so important when it comes to behavioral issues. We're talking about the environment and toxicities, helping you to keep your child healthy, but also in times of crisis or stress and anxiety, if there's divorce or death, things like that, a move to a new location or a parent relocates, anything like that, bullying, things like that. Your pediatrician is a great resource to help you with all this information. So I think it's important for parents to know that. Sometimes I've had patients come to me and they didn't really know that I can give them toilet training advice. And yes, it's definitely part of my job. It's something that I do, that I'm trained in, that I love helping parents with these behavioral issues or even developmental issues that can really help change their lives as well as their children's lives as too. So it's important to always ask your questions, because you'll probably get the answers that you're looking for. So to start with, when should you start looking for a pediatrician if you're pregnant? And of course, there's really no right answer, but to me, one of the best times is maybe towards the end of the second trimester or the beginning of the third trimester, where you're sort of nesting and getting ready for the baby, but you're still feeling pretty good about then. Probably most people, the morning sickness is gone, so it's a good time to start your investigation of finding the right pediatrician, so you have it before your baby's born. And I think that's really the easiest thing to do, is to have that pediatrician ready right when the baby is born. And sometimes the babies are born early, so it's good to have that information right away. So what's the best way to start once you decide that you're going to go down this journey of finding your pediatrician? First, recommendations, word of mouth is really important. So yes, ask your friends, if they just had babies, who their pediatrician is, family, relatives. Another good person is your OBGYN or your midwife, or whoever you're working with. They may have also a list of names of people that they've worked with in the past, or pediatricians that they know of. So that's a first good starting place. When you speak to them, what's also really important is not to just ask them, why do you like your pediatrician, which is a good question. Why do you like them? And you can ask them about office hours and how accessible they are, and do they answer your questions. But I think it's really important to ask them, what are the negatives? Like, what don't you like? Is it maybe the office isn't open on the weekends, or about the coverage? So it's important to find out the negatives as well too, because that may be more important to you. Something may be more important to you than it is to your friend, or your sister. So it's important to find out specifically so you can make the best decision for yourself. And then once you've gotten a few names, the next thing I would say is to go to the internet. It's a bit easier now than it used to be, because right now there's so much information that you can get on the internet. So first off, if you have these few names, you can go on the internet and see if they're board certified, which is important. You can also see where their medical education has been done, where they did their training, what hospitals they are affiliated or work with, how long they've been in practice. Obviously, you can see if there's any malpractice or sanctions or anything against any of these doctors that you're looking at. And normally now, many pediatricians have websites too, so you may be able to find a lot of information about the practice on the website too, so that makes things a little bit easier now. But I'm going to bring caution up, which actually I think is really important because things have changed now. As I said, it's great to get from recommendations from word of mouth, but obviously online now there's reviews, and I think sometimes you have to take some of them with a grain of salt, I'm going to say, because I think maybe you should look at the majority of what's going on, but obviously sometimes there's a disgruntled or a patient or a parent that was not happy. Maybe the child, who knows, but maybe the child was sick, or maybe they came really late and then they weren't able to be seen, or they wanted an antibiotic but the doctor really knew that it wasn't necessary and they were just irate and angry, and so then they write this terrible review because they're mad at the doctor that one day. And that does really happen. And the doctor, the way these things work is that you really can't say anything back, or you can't really take them down. So I just want to give a word of caution that it depends. You don't know who's going to write what. So I think you definitely can look at them, and obviously people do, but I think also finding out recommendations from other people as well too, and speaking directly with the doctor, which I'm going to get to, is very important as well too. I just wanted to bring that up because everything now has reviews online. As you know, there may be a restaurant that you love, but someone was having a bad day and obviously wasn't thrilled with it and they didn't like it, so it seems to now run over or spill over into physicians and medicine too. So I just want to bring that up as a word of caution as well too. So you sort of looked at some things on the internet about a couple of doctors, and something else that's obviously important that we sort of have to bring up is insurance or the monetary. And it's important to look that your pediatricians that you're looking for, if you're wanting to stay what we call in network, or they take your insurance, and for most people they are looking for someone on their plan. So you have to ask. Look on their website, specifically ask if they're taking new patients. You also want to find out if they are on your plan. Some people also opt. There are doctors that are called out-of-network doctors or concierge doctors. And so you should really find out really what that means. It may have extra fees that you pay for. You may, they'll be able to have access to the doctor 24/7, but they'll call you back in the middle of the night right away, that if your child needs to be seen in an emergency or come in, they'll take care of them. They may be able to do referrals right over the phone to a specialist without you having to go to the hospital. So there are different things. You may have more contact with them over email. So there may be, just bringing up some more things, forms. Sometimes kids have lots of forms. Offices may, in general, make you pay extra for forms. So all these questions you should find out, fees and fee schedules, before your baby is born or before you go to an office. And that's something you can do. I'll talk about either with the office manager or with the front staff when you go to meet the pediatrician for the first time. But I think you should be clear about what's covered and what's not covered. And there's usually someone in the office that can go over that information with you. Because it's already stressful when you already have a child, and having to worry about that then can be very stressful too. So I'm just going to bring that point up to you now. So what else? We talked about getting a couple of names, and I would say 2 or 3 is like a really good place to start. It could be too overwhelming if you're going to see so many different pediatricians. But you can, as I said, look at their websites first, and then call and see if they do something called a prenatal exam, or I call it a meet and greet, where you meet the potential parents, and we can discuss how I run my office and what I do at the visits, and any questions that I have, I'll ask them any questions, and any questions you have as a parent, you can ask me as well too. So it's a great opportunity to meet the pediatrician. So again, you should ask right away at the meet and greet. It's not usually covered by insurance, so if there's a fee or not. Normally many physicians or pediatricians don't charge a fee for a meet and greet, but it's something that you should definitely ask about ahead of time. So we've decided on 2 or 3 doctors that you want to speak to. So then what next? So you call to make this meet and greet appointment, and then you come on in. And what I would say is really try to come in maybe 15, 20 minutes, even longer, earlier for your appointment. And that's okay. You probably will have to wait in the waiting room because you're early. But that's kind of a great idea, just to sort of see what's happening at the front staff. How do the front staff greet people? Do they seem to listen to the parents? Because obviously I know when parents come in, they're already nervous or anxious because their child may even be sick. So how does the front staff interact? And there may also be an office manager. You can actually ask to speak to them too, and I think the office manager can really give a lot of information to you as well too. So again, you can ask them about the doctors in the practice, if there's more than one, and you can ask them who they would recommend. You can ask them about the doctors and their if they have a child, do they use someone in the practice, and does the doctor care for other doctors' children? There's sort of many different things that you can ask just to sort of get an idea. You can also ask how the doctors treats the staff. I think that's really important. How you treat other people is also important, in their bedside manner, because in pediatrics, obviously it's very important to have a skilled clinician and pediatrician, but you also want someone, right, that can speak to the parents and explain the information, because there's always high stress situations when you're caring for a child. So a parent is already on high alert and very upset and nervous or anxious when their child is sick. So you want to have a pediatrician that can help not only just hold your hand, but really walk you through the steps so you feel confident and secure and really know when it's important to call, and when that is an emergency, or if you just are just unsure, you want to be able to call and not feel like something is wrong, and that you're not being listened to. So that's really important too. You can also ask about phone calls. If you call after hours, is there a doctor that speaks to you, or do they have a nursing triage that you go through first, and the doctor only does the emergencies? So all these questions, again, the office manager will probably be happy to answer for you as well too. And then while you're waiting there, you're sitting in the waiting room, it's fine. You speak to other mothers or other fathers, caregivers, and just see what they think about the practice too. I think that's just a great way of, like, can you see yourself there? And are there toys? Are the kids playing? Does it look clean to you? Is there no garbage out? So it's hard to know with toys. This is something that you can ask, but we sanitize and we clean the toys every single night. But of course, lots of people are handling them, and it's even though we're cleaning them in between and we're really cleaning them well at night, obviously there still are germs. So my tip is always to bring your own toys, because you never know how long you may have to wait, or if you're in the room and not in the waiting room, and bring snacks and other things to occupy your child's time while you're there too. It makes it easier so you can speak to the pediatrician if your child is like looking at a book or a toy or holding their special blanket. This would be the great time to bring those objects with you as your child is getting older. So that's just a little aside tip for you guys as well too. So now you're in the doctor's office, and you probably have to fill out some paperwork, and then as you're waiting, the doctor will probably come out and have you come back to their office so you could have a chat. And it's good for both ways. I obviously like to make people feel warm and welcome in my office. I think it's important as a new mom, if you do have questions, come with them prepared, write them down. No question is silly, and I think that's really important. You should feel confident asking your questions, and your pediatrician should be able to answer them for you. And so usually how it starts out, I'll be sitting in my office, the consultation room, and I will take a history of the mom and the dad, find out any medical history that may be pertinent for the baby to be, find out who's the OB and where the baby may be delivering, and I will then ask any questions about any prenatal labs or testing, and if mom is taking vitamins, and just anything that's happening with her overall health, just to find out some more information. And then I usually give a whole spiel and really talk about what to expect when the baby's born. I do go see the babies at the hospital, but you should ask, because sometimes doctors may have a hospitalist who goes sees the baby, and then they just follow up once the baby is discharged back from the hospital, and then is seen in the office 1 or 2 days later. So it's important to ask, is the pediatrician going to see your baby in the hospital, or do they have someone that they work with? And then any other questions that you may have about breastfeeding or vaccines or the philosophies. It's really, obviously you want your philosophies to jive and to feel, as I said, really comfortable with the doctor. But it's also, if you're very nervous, you actually may want a doctor that's more laid back. If you're very laid back, it may be nice to have a doctor that's laid back, but they also then have to know that you're not going to call for every other minute. And I know some of my patients really never call, and so if they do call, I have this sort of high alert button in my head. Okay, let me find out, because they may play down things. And then there are other people that call more often, and that's okay too. So you sort of, and that's why I was saying it's so important to have a good relationship, that they really know you, and it's a little bit easier to figure out what's going on. So that's important too. So find out their philosophies on different parenting practices, on positive parenting, and you'll see if you feel like it's like a good connection or not. And then it's also important to talk about after hours. Well, actually, first of all, the hours. What hours are the office open? What hours is the doctor there? And if they're not there or they're on vacation, who will they see? A group practice can be run many different ways. It may be that you're seeing all the people in the group, and that may be then a good idea to meet all the people ahead of time, because you don't know who's going to see you. And it's also good in a group, for example, like in my practice, although we have a group and we cover together and we know each other's patients, you do have a single pediatrician who's your primary, who you see all the time for their well visits, so they really know them well for their growth, their development, for any parenting issues or concerns. But if their baby is sick, and for example, I'm not here, then they may see a different doctor. But generally, I'd say 90% of the time that they would be seeing me, or if I'm on vacation, or if I'm out a conference or something, then they may see another doctor, and I would get the information from the other doctor and on the computer as well, so I would know what was going on at all times as well too. So find out about that, and if it's a solo practitioner, that's great too. Some people like that too, but again, find out who's covering if the doctor and the pediatrician is not in the office. You also want to know what to do after hours. If it's an emergency, do they just tell you to go to the emergency room? Do they speak to you first? Do they see you in the evenings? Or do they try to handle it on the phone and then see you early in the morning the next day? So these are all very important questions, because these are it seems that babies and children always seem to get more sick at night. So after hour coverage is very important to find out the protocols and how that works as well too. And then you want to know if they have either late hours or early hours, because there's many working parents, and so that may be easier for you if you can find a pediatrician that can accommodate your hours. Because I have to say, I know it's not always possible, but coming to as many visits, even if it's a well visit, is really important, because again, the well visit's not just a checkup and vitals and some shots. It's really asking your questions, finding out what's going on with the child, and maybe there's some school issues going on, or there's bullying, or there's some anxiety or stress, or you may want to know about what products to use, or feeding questions. So we can formulate what you need to talk about, or what questions that you may have, and try to answer as many as we can that visit. But maybe there's an ongoing issue that we want to set up a consult with to come back, even without the child, if there's something that you need to talk about, or struggles at home. So I think it's really important to come to as many visits as you can. And if you can't, see then if the pediatrician can either conference call you in or call you after the visit. That actually can be really helpful as well too. So again, these are just really good questions up front to ask and speak with your pediatrician about. You also want to know if, I think I spoke about after hours, but do they allow you to email things? Do they have a portal that if you want to show them something? And I always tell patients, they can email me pictures of a rash, but it's very hard to get the whole idea of what's going on. I've seen rashes, and then when you see them in person, it's very different. Or the child may have a fever and not really know that from a picture. So it's very important if a child is sick to be brought in, and sometimes you can tell, but it's really, if you're going to diagnose someone with an ear infection or a rash or what have you, it's best to be seen. We're not trying to make it hard, but it's really good medical care to be seen by your pediatrician, especially if then there needs to be follow-up afterwards too. We won't really know what we're treating if we didn't really see you in person. So I do use emails, but it's or Skype, but also it is important to physically to have the child in front of you as well too. And I talked about, then you can speak to the office manager on your way out as well too, if you have any other questions. And then just make sure and ask if there's anything that you forgot, that is it okay if you call before that the baby is born. So you've had this great visit that you think with your potential pediatrician. Probably one of the most important things is then to go home and sort of write out a list of pros and cons, what you liked, what you may not have liked, if there's any further questions that you may have forgotten that you want to ask. And then do that for another pediatrician or two, and then really find what's the best fit for you. So obviously you definitely want someone who's board certified, who's qualified in pediatrics, but as I said, you should really have this sort of bond that you feel comfortable working with this person, because I find it so rewarding myself, caring for children, helping them to get these healthy habits right from the start. And that's also working with parents, because kids, you have to model this behavior that you want. You can't just say you want them to eat well and you want them to exercise. So I can talk about fun things that you can do within a family and how to make those, as we talked about in one of my previous videos, you can look at if you didn't see, but how to make those healthy habits stick. Because it's so important. Keeping your child healthy can really ward off so many chronic diseases, heart disease, obesity, diabetes, stress, anxiety, if we're working on it in childhood. So it's a partnership. You should feel comfortable knowing that no question is a silly question. It's only silly not to get the answers. That's really important. And if you feel that you can't speak to your pediatrician, or you feel, I've had people transfer to me that said, they didn't tell their pediatrician the truth because they thought they were going to be judged. Well, I actually think that's horrible. Like, I feel so bad. I mean, how can you get the advice and the information that you need if you don't really feel comfortable speaking or telling the truth? I'm not here to judge. I'm just here to give you information to keep your baby safe. Obviously, I try to give helpful tips that I use on my children as well, too. But I've been seeing thousands and thousands of patients and parents for years now. And as I said, I'm a mom of 3 too. So I really do get it. I know how difficult it can be. No one is looking for perfection. We're all looking to just raise healthy, happy, well-adjusted children. So I hope this was informational, that you can use, and that gave you some insight into how to choose the right pediatrician for you and your family. Again, this is Dr. Jen, and if you want more information or want more information about Pediatrician in Your Pocket, my new parenting guide for parents for children from newborns through age 2, go to my website, drjen.com, and can find out more information. It was great speaking with you, and any further questions or comments you may have, please leave them in the comments below and I will answer them. Look forward to seeing you soon. Thanks.